The secretary to the COVID inquiry has told Sky News that its chair, Baroness Hallett, will not hesitate to make recommendations about the use of social media and its role in spreading misinformation and disinformation around vaccines. The independent public inquiry resumes tomorrow with Module 4 focusing on vaccines and therapeutics. Our health correspondent Ashish Joshi has this.
The Mistry twins have had their prayers answered. Kanak was waiting for his COVID vaccine when he caught the virus and almost died during the pandemic. He spent more than 2 weeks in intensive care.
They tried the oxygen first and then that didn't work, so they had to put me on the ventilator. And luckily that worked. So
Luckily.
You
wouldn't be here otherwise.
No.
Kanak was a postman who walked miles every day. Now he lives with long COVID, which means he can barely manage a step.
I still struggle to walk, at any distance, and I struggle to do my housework, and I get help to do my washing and cleaning. I can't do. I have to get someone in to help with the cleaning.
His twin brother was a COVID champion and a contributor to the inquiry's Every Story Matters campaign. Kirit helped local health leaders to get their message through to sometimes hard-to-reach communities. How difficult was it to engage with some of those South Asian communities during the pandemic to try and increase the vaccine uptake?
I think a lot of the misinformation was coming from, from our own countries back home, also from in this country as well. And it was people may have lost somebody, and hence they put it down to the vaccination was the cause of that. So it was really trying to get people to understand that, being hesitant is, and working on the misinformation is not the right way, because we needed to protect ourselves.
Leicester spent more time under COVID restrictions than anywhere else in the country. Around 8% of the people here said they didn't intend to take the vaccine. That's double the national average. The East Midlands has also seen a decrease in the number of children being vaccinated against measles, mumps and rubella every year since 2021. Will the chair have any power herself to stop social media being abused for misinformation or disinformation purposes?
We will be looking specifically at misinformation and disinformation and whether that led to vaccine hesitancy. I'm not going to try to preempt the evidence that she might hear or the recommendations that she's going to make, but she's determined to make sure that the UK is better prepared for the next emergency.
Falling levels of childhood vaccines means that England no longer has the population immunity recommended by the World Health Organization to prevent future outbreaks of illnesses like measles, meningitis and polio, leaving vulnerable communities more exposed than ever. Ashish Joshi, Sky News in Leicester.